Fertility patients routinely pay between $12,000 and $25,000 out of pocket for a single IVF cycle. For that price, they rely on the clinical team to be flawless, expecting the administrative team to handle their insurance perfectly, every single time. But while patients demand perfection on the front end, the back office tells a different story. Highly specialized practices are quietly bleeding revenue through administrative gaps. In 2023, the average denial rate for fertility claims was nearly 14%, roughly 1 in 7 submissions. Applied to treatments costing $25,000 per cycle, this 14% failure rate translates directly into severe revenue loss over a fiscal year. A 14% denial rate represents a systemic failure that directly drains the practice's bottom line. Friction begins before a claim is even filed. For fertility treatments, almost everything requires prior authorization. Nationwide, the average practice completes 39 prior authorization requests per physician every single week. Managing those authorizations consumes roughly 13 hours of physician and staff time weekly. This workload creates a cycle. Employees are hired, overwhelmed, and leave. Billing staff turnover exceeds 20% annually. Every departure forces the practice to absorb hidden costs of coverage gaps, paying for recruiting and training overhead while claims slow and denials pile up. Relying on a constant rotating door of burned-out in-house staff makes scaling a modern fertility clinic mathematically impossible. Standard medical billing usually revolves around a single, straightforward office visit. An IVF treatment cycle is a different conversation. This timeline maps a single IVF cycle, containing dozens of interconnected nodes for discrete events like ovarian stimulation, egg retrieval, and embryo transfer. Every step requires specific CPT codes, documentation, and payer-specific modifiers. If an undertrained biller misses one modifier on a retrieval claim, the node turns red, the claim is denied, and the revenue cycle breaks. If the team forgets to front-load a prior authorization before the baseline ultrasound, the patient's physical treatment window can close. They lose an entire cycle, adding months of waiting to a process that is already financially and emotionally exhausting. These errors are rarely caused by carelessness. They are caused by a volume of payer-specific rules that change faster than a small in-house team can track. Applying a general medical billing approach to the multi-stage complexity of IVF results in delayed patient care and continuous revenue loss. Smart practices are fixing this by abandoning the generalist hiring model. Instead, they move their billing to specialized outsourced teams that work directly inside the clinic's existing electronic medical record system. These are credentialed experts holding AAPC and AHIMA certifications. They arrive already trained on the correct modifier usage for oocyte retrieval and genetic testing. These teams are augmented by AI-powered workflow tools. The system routes tasks based on payer urgency and runs automated audits to flag errors before a claim is submitted. This transition provides technical capacity to handle infinite payer complexity without the friction of internal turnover. An in-house billing specialist costs up to $75,000 a year. A dedicated outsource seat delivers the same workflow for $399 per week. These specialized experts also drop the error rate from 14% to below 1%. Clinics can test this math directly. An EMR connection is established quickly, going live in just 14 days, verified through a risk-free pilot. For a high-revenue fertility practice, moving to specialized outsourcing is a necessary financial imperative to secure the clinic's future.